the chat? Wait, where is the chat? No. Hello? Ayun, okay, there we go. Ventix, hello! Hello, Pokari! Hello, Archetype! Hello! Hello, good evening. Okay. This is going to be more of a question and answer, so shortcut tutorial. Yeah, I decided to have my hair short because it's kind of hot today. So, oh, you know what? Let me zoom myself a little more here. There we go. I think that's better. Okay. Hello, Excalibur. Hello. So, I already saved the questions. So we have a few questions from my marshmallow. Okay, and I'll be answering them. So, how many are there? I think I didn't even count how many they are. Hindi ko na binilang. I didn't count them anymore. How's the doctor doing? I'm doing great. I'm fine. I put the ShioriPon. Yeah. So this is more of a question and answer thing. I will try to answer your medical questions to the best of my ability. I am a surgeon, right? I'm a surgeon, so I can only answer and, answer so much. I mean, if you're gonna ask me, like, I think I have some specialized questions over here. Like, I mean, some questions here that are pretty specialized. So, I might not be able to give a satisfactory answer. I'll try my best, though. Hello, Neutrophil. Fi the Neutrophil? Hello, welcome to the stream. No, good evening, Dr. Lang. May problema. Battery. Oh, no. Okay. That's fine. Hello, Rion. Hello. Okay. So, I already saved the shots of the questions. So, we have a bunch. Let's see. Hello, Wendell. Hello. We have a bunch of questions over here. Alright, let's flash them. We're gonna flash them. Okay. We got one question over here. And it's a question that's not under my specialty. We got one question, so this is actually a derma question. This is a dermatology question, yo. What are the common reasons why people do have eczema? This is eczema. Skin. I hate skin. Skin is more handled by dermatologists, but eczema is basically irritation and inflammation of the skin. Okay, so there are many causes of this, like a lot. Like dermatitis is one. Dermatitis is one common one. So there's really a lot. Like allergic reaction is one example for a cause of eczema. Because eczema, if I remember correctly, eczema is not exactly a diagnosis, I think. It's more like a condition, but it's a condition that is under a diagnosis. You can have you can have eczema and different types of illnesses. So one of them is dermatitis. Like there's different kinds of dermatitis. There's atopic dermatitis, allergic dermatitis, and all that. Contact dermatitis. Yeah. Instead of skill issue, duck has skin issue. Yeah, I know. I mean, skin is not exactly my forte, okay? Skin is more of a dermatology thing. So we do handle some skin conditions, like, let's say, like, but not like stuff like eczema or dermatitis or stuff like that. If us surgeons were to handle skin, it would be something that's like cancer or like a mass, tumors. Like skin cancer. We dermatologists handle skin cancer, but then surgeons also can handle that. Of course, dermatologists are trained to do a specific kind of procedure, operative procedure, which is called the Mohs surgery, which is a very, very, how do you say, a Mohs surgery, M-O-H. Mohs surgery is like, they remove the tumor in as, with minimal margins, as like the most minimal margins as possible, so that, you don't have a big defect. So, that is something the dermatologists do. I have no idea how you do that, but I just know the concept. So, yeah. But that's for like tumors and cancers, right? So yeah, there's like a lot of reasons to have eczema. Yeah, you just need to find the underlying condition or the what illness is causing it, and then that's how you can prevent it. Okay. Hello, Tanupat. Hello, it's been a while. Psoriasis? Wait, psoriasis with eczema fall under psoriasis? Oh yeah, eczema has psoriasis as one. Yeah, psoriasis. But psoriasis is different in that psoriasis is different from like dermatitis, because psoriasis is more chronic, and dermatitis has like a triggering factor. You can like not have it and then have it after a certain trigger factor. But psoriasis is something that you have. Once you got it for life. You just gotta, what you can do is just like avoid the stressors that flare up your psoriasis. That's one. Psoriasis is pretty annoying, to be honest. You know what? I have one medical school classmate who didn't have psoriasis and started having it when she entered med school. So it's kind of, psoriasis is stress induced. To be honest, I also have. I have psoriasis, but mine is like limited to my scalp. And it's annoying. Freaking scalp psoriasis annoys the shit. At least, well, to be fair, at least it's just limited to the scalp and nothing nowhere else. But, you know, I never had that, and then I suddenly have it. I just got it, like, because of stress from work. Yeah. But there's like stuff you can apply to the skin to like, you know, lessen the itch and all the flaring. So you just gotta, you just gotta treat it symptomatically. And there's, as far as I know, there's like different kinds of psoriasis too. But I don't know all of them because I'm not a dermatologist. So yeah, even I had to see a dermatologist for my psoriasis. Alright, so I think I've answered this one. Let's see now. Okay. Alright, let's go to the next. Oh, there we go. What was the largest volume of abscess collection you have? Oh! What? Wait. The largest? What was the largest I've ever collected? Wait. I think the largest volume of abscess I've ever had to collect in a surgery was 2 liters. 2 liters! Imagine that! I can fill up 2 liters of absolute water or something. 2 liters! That was the largest. As far as I know. In which part of the body? Inside the abdomen. 2 liters. Yeah, 2 liters. Or 2,000 milliliters. I don't know how... if I remember correctly, the cause of that was just, I don't remember if it was appendicitis or something else. But, yeah, it was around 2 liters. I'm having breakfast here. Well, why are you having breakfast in a minute? You're having breakfast in a risky stream where people can ask gross questions and I will answer them. And we got one abscess, which is like really nasty. IC, wait, what? You tabby which way ICD or excision? What do you mean by that? Like how I drained it? It was an exploratory laparotomy, so we had to open up the patient because he had abdominal pain. I don't remember if it was appendicitis or something else, but he definitely had some infection going on, and I had to drain that, and it smelled bad. It was around 2 liters. That's probably that's the largest so far that I've had. So peritoneal abscess, yeah, or intra-abdominal abscess. It is gross. Sometimes they smell. Yeah, I guess we're done with that one. Let's see. Next. Oh, this is the ballot. 10 years na ako sa call center. So, I've been in the call center for 10 years. 10 years na ako naka-night shift. So, this person's been night shift in the call center for 10 years. So, I sleep in the morning. Does sleeping in the morning have the same effect as sleeping at night? And what's the ideal hours of sleep? Well, for an adult, 6 hours is fine, actually. You know, a lot of people would say 8 hours of sleep is how much time you have to sleep, but that's for, like, as far as I remember, that is for younger or children. Because, you know, younger kids or younger people have to have longer sleep. But if you're an adult, 6 hours is enough. Rion, I call that skin... That is disgusting! That is gross, Rion! What the heck? Anyway, yeah, the adequate hours of sleep is around 6 hours. But you know, a lot of people, a lot of people get less. To be accurate, teenagers is 8 to 10 later. Yeah, there we go. It's around 6. 8 is good. I mean, 8 would be nice. But 6 is okay for an adult. 6. Like, the younger you are, the longer. So, you know. As someone in the BPO business in the 8 years, 6 to 7 is good. Yeah, 6 to 7 is good. I mean, for me to get 6 hours of sleep is a freaking miracle. Although I am able to get 6 hours of sleep, but most of the time I get 4 to 5 hours. This is why I have psoriasis. And this is why I have psoriasis. I heard it's difficult to fully adopt a night shift body clock. I'm not so sure because I know some people who do have night shifts and they are freaking awake at night and they're like dead asleep in daytime. Yeah. So, I don't know. I think it depends on the person. Because I'm awake at daytime. It's just that I try to get sleep at night, even when I'm on duty. Eye bags. You know, for me, who gets like 4 to 5 hours of sleep, I don't get much. I actually don't have eye bags. The only time my eye bags come out is when I'm like on duty and I don't get sleep at all, or if I get only 1 to 2 hours and I'm just awake, then I get the eye bags. The less sunlight on your skin, the less like your skin. That is maybe that's why I freaking live inside the hospital. Maybe that's why I don't age. I'm not getting any sunlight. I'm just in the hospital. Is this why every time I see a patient and they're like, Doktora, ilang taon na po kayo? I'm like, I am ganito years old. And they're like, oh, ang bata mo pala. At mukha kang mas bata. I'm like, yeah. Ang bata mo pala, pero mukha kang mas bata. I get that a lot, yo. Shiori, I'm 157 years old. Bruh. So, I get a lot, you know. They would be like, ang bata mo, but then I look a lot younger. Shiori was in the ER with Rizal. What the frick, Okay. Next. Is it normal to poop bloody liquid after a heat? Wait, what? Why are you having... Wait. Bloody liquid. Oh, so I'm guessing blood or bloody stools. Oh, bloody liquid. After heat stroke. That is not normal. In the first place, getting a heat stroke is not supposed to be normal. You're not supposed to get a heat stroke. Why are you out in the heat? Get out of the heat. Drink lots of water. Stay somewhere that keep yourself cool. Hydrate. It is not normal to poop blood. Never normal. Never normal to poop blood, okay? If you start pooping blood, it depends on you either have hemorrhoids or you have something inside your intestines that's bleeding. And you gotta have that checked, especially if it persists. But for like people our age, younger, it's usually hemorrhoids. Wear hoodies if it's hot. The heck? It's usually but anyway, it's usually hemorrhoids. Although there's some who get, like, tumors. I actually had patients who were, like, really young and they had a tumor. Like, cancer kind of tumor. What else? Oh, and other than hemorrhoids, you can also have fissures. Anal fissures. Those things hurt, yo. Anal fissures, like, I have had patients who had anal fissures. It's basically like a freaking... Well, it's self-explanatory. Imagine having a fissure in your anus. That hurts. That hurts. And I've seen it, and when I look at it, I feel like my own butthole hurts. I feel the pain. I'm like, oh my god, I feel the pain of this, whatever I'm looking at. I have hemorrhoids. I can confirm that is a pain in the ass. Oh man. I hope that's reducible though. Hemorrhoids is easy to treat though, to be fair. If you just, as long as it's like, reducible. Okay. So no, it's not normal to poop bloody liquid, okay? Or to poop blood. You gotta get that checked. and you shouldn't get a heat stroke. You should hydrate. Next question. What is the best part of being a surgeon? And any memorable surgeries you've had in the past? Oh, best part of being a surgeon. Oh wait, hold on. Bokarida, so hemorrhoids is permanent? Not really, no. It's something preventable and, you can have it, but then it's something that would be, there are different gradings for hemorrhoids. So, you can have hemorrhoids or enlarged hemorrhoids, but then they're not so large that they're bothersome. That's what I mean. Like, everybody has hemorrhoids, because hemorrhoid is technically the blood vessel piles in the anus. If they just enlarge or engorge themselves, that's when they become symptomatic. So sometimes you could have enlarged ones, but they're not that large to cause any symptoms. So yeah. Anyway, what is the best part of being a surgeon, and any memorable surgeries you've had in the past? Best part of being a surgeon, I can cut people. I can cut people, and I can see their insides. That is one of the best things of being a surgeon. I can cut people. I can see the insides of their abdomen. I can see inside. I can see them. Yeah. I mean, when you think about it, think about it, guys. A surgeon has the license to cut people, right? We have the license to cut people. So isn't that fun? Isn't that fun? That's fun. You just put them under anesthesia. You just put anesthesia so they don't feel any pain. Isn't that fun? I mean, the opposite of a surgeon. The other side. If it's not a surgeon, it would be a pathologist. A pathologist cuts things, but they only cut specimens, or if you go into forensics, you're just cutting dead people. That's not fun. That's not fun. They're dead and smelly. Yeah. So yeah, that's the best part of being a surgeon. It's like you have the license to cut people, and the people you're going to cut actually place their trust on you to cut them. Diba? That's the best part. That is the best part. Okay, memorable surgeries. Let's see. What is a memorable surgery? I have so many surgeries. Wait, let me think. Let me think about this one, because oh, there is one. There is one memorable surgery. One of them is that patient we helped with our donathon. Definitely that one, because he was a case. I know I discussed it in one of my past medical education streams. He's a case of thyroid. He had a thyroid, a goiter. He had enlarged thyroid, which reached all the way into his chest. So that one is memorable because I was able to help him with the help of chat. The stuff he needed for that surgery, for that big surgery. We were able to do it. And he was lucky that his condition isn't cancer, actually. He's lucky. It was just goiter. It's good. Now, another memorable surgery I've had. Let's see. What's that one memorable surgery? Let me think about it. Let me think back. Let me think back into one surgery I've had in the past. Probably. Usually it's the patients that make a mark on me. I've had a patient before that had gallstone surgery, who had her gallbladder removed, and then she came back all yellow because apparently she still had stones in her bile ducts and we had to take that out. And then she was discharged fine. And then she came back again because she was obstructing, so we needed to fix that obstruction, and she was fine. And then she came back again after a while because she had a hernia because of so many surgeries. Have you performed a surgery where the patient is watching the procedure live? Yeah, minor procedures basically. Minor procedures, you just use local anesthesia so they can actually watch you if they wanted. Then I get, oh yeah, Excalibur, that one, yes. That one, that is one. There was this dude running from the police and he got shot. He was running from the police and he got shot in the balls. And what's wild is that the bullet didn't even hit his testicles. It just went through the scrotum and his balls dodged the bullet. That is one. We just had to debride. We did a scrotal exploration and then we debrided. We did a debridement of his wound. We didn't have to do anything to his actual balls. No. And multiple potential future generations. Yeah. I remember that one, yo. It's wild. Isn't that a job for urology? Yeah, but it's a trauma patient, so we can actually go into. Yeah. It's trauma. Because he got shot. Evasion level 100. Yeah. What's another one? Another memorable surgery. Let me think. Oh! I remember one. Trauma. Another trauma patient. Okay, this guy was super lucky. This one was super lucky. He, we had one patient who, I forgot what. I think he argued with his wife or something. He had an argument with his wife. And then, because he argued with his wife, he, got suicidal. So he stabbed himself. He stabbed himself 3 times in the abdomen with a knife, okay? The knife was like one of those ridged knives, or I don't know what you call those knives with the ridges on the other end, but basically it was that. He stabbed himself in the abdomen, so he committed Sudoku. But then 3 times. And when you look at the abdomen, when you look at his abdomen, you could tell that he was hesitant to stab himself because you could see the other stabs were not deep, or they were narrow or small, until the final stab was when it went through his abdomen. No, it's not a bread knife. So we had to operate on him because obviously the knife went through. And we had to operate. And then when we opened his abdomen, when we opened him up, he was so lucky because the tip of his knife was just resting on top of his transverse colon. It did not injure any internal organs. It was literally just there, resting on top of his colon. And we were like, yo, what is this lucky son of a bitch? Lucky bastard, yo. He was lucky. So we just had to extract the knife and then he closed him out. When you have bad I think it was more that he was just hesitant to really kill himself. all planned by him so his wife could check him. I don't know, man. But, he didn't have any internal injuries. When you want to know live what your precision was. Usually it's the trauma patients that are interesting, actually. Like, I had another one, but we didn't operate on him because he was a lucky bastard, too. He was according to him, he was sleeping. Okay, this is according to him, okay? He was sleeping, and then he got stabbed in the neck by a knife. Okay? Through and through. It was, actually the stab was on the, angle of his jaw on the left. And then the tip of the knife came out on the right side of his neck. Okay? He got stabbed like that. And he came to the ER because, of course, he was bleeding. So, we were like, oh my god, neck injury. Oh my god, neck, stab wound to the neck. We gotta check if any of the vital, the blood vessels were injured and all that, right? So, I checked him. His vital signs were actually okay. There weren't any hard signs of internal hemorrhage. Okay? So I'm like, I think this guy probably got through. Okay? So I said, let's request for a CT scan. And we gotta check for the trachea, if there's any injuries, x-ray and all that. And upon doing all those diagnostics, so the CT scan told us that there were no injuries in the blood vessels of the neck. No injury to the carotid arteries or the jugulars. And there was no injury to his trachea or esophagus. So that knife just passed through the fat of his neck, okay, like a little anterior, like superficially. It did not pass through or hit any of the, blood vessels, the trachea, the esophagus. It hit nothing. It just hit his like fat, neck fat. And all we had to do was just suture his wounds. He was lucky. He was lucky. Okay? So, but then, he was really lucky, but that patient was a pain in the butt. He's a pain in the butt, okay? I told him he's not allowed to eat. This patient is not allowed to eat because we gotta monitor him. If he eats, something might be wrong. Because, we gotta make sure everyone there are okay. But you know what he does? He eats a freaking chicken meal. Kakain ng 2-piece chicken sa Uncle John's. He eats a 2-piece chicken meal and tries to hide it. I'm like, what? He's like, bro, you're not allowed to eat. What are you doing? And he's like, no, I'm not eating. I'm not eating. No, I'm not eating. And then this other patient across him in the same room was like, hindi, kumain yan. Sinumbong. Hindi, kumain yun. Nakita namin, kumain yun. Nagsisinungaling. Nilaglag, gago. Nilaglag siya ng katabi niya. Katabi niyang pasyente. I'm like, oh, ba't sabi niya kumain ka? Tapos, that guy was like, nakasimangot. Nakasimangot tuloy. So, yeah, that's well, anyway, yeah, to be fair, to be honest, actually, the patient was stabbed in the neck, and he's an asshole. He was a pain to manage in the wards because he doesn't listen to me. He does not listen to me. So he was annoying. He's lucky he's still alive. Okay, he's lucky he's alive. But he was a pain to manage. I mean, this is when you realize, patients like these, patients like this, that, like, you get stabbed and all that, they get all these injuries, they get hit, The first time you see them, like, oh shoot, we gotta save him. We gotta. Why would anyone do this to this person? You know, you would feel like that. Why would them do this? Freaking demons in the city. Demons in the city I live in, stabbing and hurting people. And then when they start getting better, you know, these patients, when they start getting better, they start their true colors come out, and then you realize, eh, kaya pala sinaksak. Kaya pala sinaksak siya. Freaking, you know, you realize they're freaking assholes. Tapos, ayun. Kaya pala sinaksak. Kaya pala binugbog eh. Like, yeah. But then you're a doctor, you can't do anything. You gotta treat them no matter how annoying they are. You gotta, you know, keep to the hip. We gotta keep to our oath and we can. May rason naman. But then you just realize, like, kaya pala sinaksak ng gagong to. Kaya pala eh, kaya pala binugbog to eh. Kaya pala sinaksak ko, kaya pala binaril siya. Yung ganun. You know, you just realize that after a while, like, okay. Alright, we'll go to the next question. Oh, this one's long. Wait, hold on. Okay. Not related to surgery, but I'm curious to know if you have any requirements in your licensing to learn a certain amount of knowledge each year for your profession. We have mandatory hours in my profession that we need to reach each year where I am from. If yes, do you have any topics in the medical field that has piqued your interest recently, like recent studies, medical... Oh, wait, really? I don't think we have this. We don't have this, per se. If this is, we don't have this, no. We don't have this for our license. I mean, once you're licensed, you're licensed. Okay? I think, if anything, to renew your... There are requirements to renew your license. Like, in our country, we have this thing called the CPD units. I forgot what's... CPD units. I have no idea what CPD stands for. Credit units. But we need this to renew our licenses. So basically, you have to participate. To get CPD, you have to participate in, like, conferences and lectures and stuff. So that's actually why I have to attend these things, because, you know, if I want to renew my license, I need to have those CPD units. So, you need that, and then to renew your license. Let's see. My country has one. Need to test. Oh, okay. If it's like a licensure exam to become a doctor, then you only need to take one. Because when you're in med school, you graduate, you take the PRC, or, well, in ours is the licensure exam. And then once you get the license, then you're a full-fledged doctor. But it's the renewal that is a bit, you have to attend all these things to renew your license. So, hello, Fact, thank you for the alert. The sitting, Pokari, the sitting in a convention, what you do is you just need attendance, okay? You just need the attendance and the certificate. The certificate is like your key to get the CPD units. So you need those. So this whoever asked this, we don't exactly have that. It's not something mandatory each year, but something mandatory for every time you need to renew your license. So I didn't know about this one. This one sounds so strict and hard though. So yeah. All the professionals I know that need to get the CPDs curse the hell out of. Yeah. don't like the CPD thing, to be honest. It's kind of annoying. I don't like the CPD unit thing that they applied here. Anyway, yeah, there, that's... Okay, next! Hello, Podoc! I just want to ask on how do you usually handle patients when they're panicking? Huh. Okay, there are two ways to do this, okay? Usually this happens in the ER. There are two ways. So, in one scenario, you have a patient that is sick, goes to the ER, and then they panic about their illness. One way is to like calmly reassure them. Calmly, okay? I usually go for the calm reassurance, usually, okay? But then if you have a crazy ass patient, like a patient who just you know, is very vocal about it, then I will be vocal. I will raise my voice, like, yo, calm down. No, I would raise my voice. I have to be more on the commanding position, right? I can't let the patient, like, control me, manipulate me, whatever. So, it really depends also. You have to know your patient. You have to know your patient. There's also a third option where, you know, you just, if they're panicking, all you gotta do is just tie them up and put like gauze in their mouth so they shut up. I'm just kidding, but don't do that because you'll get reported and then you'll lose your license. Don't do that. Tied up in the bed. Yeah, that's 1 4-point restraints. That's usually for patients who are hard-headed and, you know, they don't follow your instructions. Okay. So, yeah, you just gotta know your patient. You gotta know your patient that if a calm reassurance won't work, you have to be a more commanding. Okay. So, I try to reassure. Most of the time, I try to reassure. Because, it's really hard when the patient's panicking. I've had patients that don't exactly panic, but, you know, they get so worried. They just don't say anything, but they get worried, and they start thinking about their illness. You can tell. Because if you do rounds on them every day, you can see how they are. Like, the first few days, they're okay. They talk to you, and like the next few days, once they know their illness, they start being really quiet and look all sad and depressed, you know? I've had patients that just get so worried or panicky about their illness that you really have to stay in command. So yeah, there's two ways. The calm way or the, you know, the more commanding way. Alright, next question. I saw a viral clip of... the pee-pee of the guy was girthy. In the middle part. Only like a question. Is that normal? I think I know what this is. Is this a stupid trending... Oh my god, is this the trending video where they were doing some actions and shit, and then all of a sudden you see pee-pee come into the screen? There was like 2 videos I saw where it was a gay guy doing actions. It was on Facebook. I can't share it here because it's you know, it's not safe for work, you know. I think it was Yuria who had it. It was Yuria who showed it. Tinignan ko. Silas knows about it, but Silas is not on the stream. I have no idea what the thing is called, but Yuria shared it, okay? Yuria shared it on Facebook. It's basically, the first one I saw was basically this guy He looks like he's gay. He's dancing in front of the camera, and then first he covers his face, he covers his face and then shows his eyes, and then on like his right side, something long and thick just pops up, and then he just puts it in his mouth for like a second. Then he just continues dancing, and you're like, what the fuck was that? What the fuck was that, yo? And then there was another one where it was a girl. It was a girl doing the same thing. And then on her side, it was a penis that outright penis that looked funny. Okay, it looked funny, and people were like asking on that video, like, why does his penis look like that? And when I saw it, I'm like, oh my god, my bulitas. So I think that's it. Girthy in the middle part, I think my bulitas yun. That one video with the girl, yo, and then the guy just shoves his penis there. I think he has my bulitas yun. Bulitas is what is bulitas in? Bulitas. Yeah, it looks like he has bulitas, but I can't tell you what kind of bulitas he has, but it looks like the kind of bulitas that, you know, patients come to the, you know, our patients have. Oh, okay. Bulitas is penile implant. There we go. Penile implant. I think he has it, but he did not use beads. He used something else. He used something else there. Probably some gel, or oil, like other people do. People like to inject things in their thing, okay? So, yeah. That one, it looked like bulitas to me. That a bad thing? Well, if you're gonna think of it this way, it is bad because people who do it themselves tend to inject petroleum jelly, baby oil into their penises. That's bad because you're not supposed to do that. There's some people who do that. Like, if they can't afford the actual balls or the material for that, for the penis penile implant, they do it themselves using whatever they can find. So, to answer this person's question, if it's normal, I'd say it is probably a normal penis, but it has some stuff in it. It is a normal penis, but it has things. It has stuff. I mean, if we're gonna talk about penis sizes and shit, there are different kinds of penises. There are thin penises, there are thick penises, there are curvy penises, I don't know. But, they're all normal. It's just that the one I saw, I think he has bulitas. Okay? I think he has penile implants. Alright, next question. Oh, this one's long. Oh, this one's long. Okay. My mom got diagnosed with cellulitis on her right foot and has recovered from it. But she still pokes around one of her wounds on her foot using various items, mostly manicure-related ones. Oh. I needed to know, can this infection be caused by the use of unsanitary manicure items such as nail clipper and nippers? Okay. Would complications of this disease lead to possible amputation? And pardon if it's an off-topic question, but if she ain't gonna listen to her children, maybe she'll from a surgeon. Alright, okay, let's go into this. Okay, cellulitis on her right foot, which she recovered from, but she pokes around in her wound. That means she has a wound, or maybe a non-healing. I would say it's a non-healing wound on her foot that caused inflammation and cellulitis. And then she has a wound which she pokes around. I guess kinakalikot niya gamit ng whatever. She pokes it around with whatever she has. So, yes, number one, yes. The infection can be caused by that. Okay? From using whatever the crap she's using to poke her wound. Yes. It's a source of infection. I mean, if you have a wound on the foot, what you do is clean it. Not like poke it with things. You gotta maintain that area clean. Okay? You gotta maintain that area clean. So, one way is to use saline solution and then gauze. Put it on top. And then a dry gauze on top. And then tape it. Okay? Don't use... If she has a wound that annoys her, like, tell her to not touch it. Cover it with something. Okay? Don't let her use whatever manicure-related things on that. Especially if it's not clean. Okay? Number 2, would complications of this disease lead to amputation? It depends. It would depend. Is she diabetic? If she has diabetes, she has that would count. That would make her foot a diabetic foot. If the wound does not get any better, if it gets larger, and then the foot becomes all smelly and like gray or black, that would mean it's an unalive foot, and it will lead to amputation. Okay. Debridement? No, debridement can be done. Debridement can be done for like smaller wounds. But if you're gonna be dealing with bigger wounds that get larger and larger, to the point that the foot itself has a discoloration, it turns black or grayish black, then yes, it can lead to amputation. It can. But so this is why, if you catch these things early, you gotta catch these things early. If she's diabetic, you gotta get that diabetes treated. Because diabetes alters the healing process. It affects the healing process. So yeah. Maybe she will from a surgeon. Yes, I hope she listens. Problem is, I'm an anime girl, so she might be skeptical about me. Your mom might be skeptical about me. Unfortunately. They'll be like, why are you listening to an cartoon character about this? Hindi naman yan, doctor. I would think that would be the most plausible reaction that she would do. But you can try. You can say, I have listened to this doctor online who looks like a cute anime girl with buns giving advice. No, but really. If she's hard-headed, if she doesn't want to listen, it's better to drag her to a clinic, okay? And have a doctor actually talk to her face about her condition, You gotta drag her to the clinic. Okay. Alright, next. Or at least, if she really wants, if she really wants to, kinakalikot niya yung sugat niya, just clean it. Have her clean it with saline solution and gauze. Okay? Alright, next question. What's a procedure you want to try doing in surgery? I want to try doing everything. Try everything. You know what? You know what I want to do? I want to learn robotics. Okay? I want to learn robotics, actually, because that's the future. I can do laparoscopic surgery, but then robotics is interesting and I want to learn it. That's pretty cool. It's like playing video games, but then you're operating. So that's one thing I have not tried, robotic surgery, where you use robots to operate. Have you been to a heart surgery putting pacemaker? Open heart surgery I have assisted when I was a junior resident. But pacemaker, not yet. Actually, I have not. So yeah, that's basically the kind of procedure. Maybe robotic, like removal of the gallbladder and robotics. That would be cool. Okay, next question. Can you teach me to approach jaundice in med condition? What? Can you teach me to approach jaundice in med condition? What do you mean by in med condition? I can get, okay, to this person, I can teach you jaundice. Okay, I will tell you how I approach jaundice, okay? Oh, Frotter, have you seen the video of a surgeon using a robot to peel it? I have seen laparoscopic surgery to peel a grape, and I have done that actually. I've tried that. But robotic, I have not. Okay. Okay, for the jaundice, I will tell you how I approach jaundice, okay? As a surgeon. If I have if I get a patient that comes in yellow, okay, patient comes in yellow, or I get a referral saying, oh, this patient's jaundice is probably for you, it's a surgeon thing. First, I will take their history and their physical examination. Physical examination is important, so aside from them being yellow, you gotta check for abdominal pain. Okay? Abdominal pain and other, whether they have it on the left upper quadrant or the left upper abdomen or the right upper abdomen. Okay, just check where the pain is. And then, one of the most common causes of jaundice. So when I see someone with jaundice, the most common cause of jaundice is a biliary obstruction, okay? So, a stone from the gallbladder that has fallen and got stuck in the common bile duct, okay? That is the most common cause of jaundice. Especially for surgeons. So that would be the first thing I'm thinking about. Like, oh, someone's jaundice, okay, we gotta check if this patient has abdominal pain. Okay. So, if the patient has abdominal pain, the next thing you do is request some diagnostics. So, ultrasound is the best one because that one is the best for gallbladder. Okay. Whole abdominal ultrasound, and then you can request for some blood tests like liver function test, and at the same time you want to rule out hepatitis because hepatitis is kind of common here in the Philippines, so you gotta request for a hepatitis profile. Okay, so depending on that, like if you have a negative ultrasound but a positive hepatitis test, then you know your jaundice is from hepatitis, and you gotta treat it accordingly. Now, if your hepatitis test is negative, and then in your ultrasound, they say, oh, you have stones in the gallbladder, and you have stones in the common bile duct, causing obstruction, and there you go, you got your source of jaundice. That's one, that's the most common cause. Next cause of jaundice is a tumor, which, basically the presentation is, you do the same. If it's not, you would do a, what do you call this? A CT scan or an MRCP. If there's a tumor in the head of the pancreas, then that can also cause jaundice because it's causing obstruction in the biliary tree or the biliary ducts. So that's one. And then, so that's surgical. The rest though would be other causes of jaundice. Could be liver problems, which is why you request for a liver function test. You can have jaundice from liver cirrhosis. You can have jaundice from blood problems also, actually. That's one of the last things I think about. Blood problems. Or even sepsis. What about extra? Yeah, that one. Blood problems. Usually blood, the extravascular hemolysis, that can cause jaundice. But that's more of a medical thing, not surgical. So the first thing I would think about is gallstones or CBD stones, or what do you call it? Common bile duct stones, biliary stones. If this question is for med school, you might have to, if I remember correctly, there is a algorithm for that. If I remember correctly, because the information I'm giving you is based as a surgeon, okay? So the first thing I would think about is something surgical. You gotta rule out surgical causes. Okay, next. Oh, it's already 10. Alright, next. Hi doc, is it advisable that I get an appendectomy? Even if my appendix isn't showing any signs of rupture? Sorry if the question has already been asked. Hope you get to do more med streams. Aw, thank you. Okay. If you have acute appendicitis when your appendix is inflamed, it is advisable that you get appendectomy. Okay, whether or not it ruptured. If your appendix ruptured, then yeah, you most definitely need to have your appendectomy. Now, if I remember correctly, there are some studies or like some doctors or surgeons that do what we call interval appendectomy. Like they would present with signs and symptoms of appendicitis, but then it's not severe enough. Like what they would do is just give the patient antibiotics and then just close watch, and if the patient improves, they don't do surgery, which is something new, because I mean acute appendicitis is something an emergency. It's usually an emergency or an urgent problem. You gotta have surgery for it. So there are some disagreements between those who believe that surgery must be the treatment versus the ones who believe, you can use antibiotics. So, yes, if you have appendicitis, if you are diagnosed with appendicitis, especially when you have symptoms, get an appendectomy. You don't wait for it to rupture. Don't wait for it. Because there are times some people have ruptured appendicitis and it doesn't end well. Alright, hold on. I'm just gonna get my drink. I apparently don't have a water with me. I will be right back. Okay, I will be right back. Hold on. Okay, I'm back. Okay. Alright, I think we answered this one. Okay, so we go to the next question. What's a procedure you want to try assisting performing in surgery? I did say it before. I mean, same thing, like robotic surgery. It's basically the same as a while ago. Robotic surgery. Yeah? Okay, so next question. Okay. Next question. Here we go. Thank you for the medical stream, Shiori-sensei. Why is it that every time you're eating something sweet, you got some urge to eat something salty, then vice versa? Is it for my health? If it's alright, can you say ara ara? There you go. Again, thank you for the medical services you do for everyone. Okay. So, wait, hold on. I just checked Marshmallow, and I think there's more questions added here. Yeah, I got more questions here. Okay, I'll go through that later. Alright, what was I gonna say? Oh yeah, why is it every time you're eating something sweet, you gotta urge to eat it? It's not something to do with health, you know. This is not something to do with health. It's how do you say? Parang pangtanggal umay yata or something like that. How do you say that? It's like countering. There we go. Countering the flavor. The flavor. It's not something to do with the health. Who asked this question? I don't know. Someone who wants the ara ara. But yeah, it's not a health thing. It's more like a counter to the taste. Okay. Neurological. I guess neurological. It's nothing like health related, or it's like how do you say? I don't know how else you say it. Like countering the taste of something strong with another strong taste. It's like when you eat sushi or sashimi, they give you this ginger to take out the, to counter the strong fishy taste. Something like that. Counterbalance. I think that's it. Yeah. I mean, that's why they have like sweet and salty, popcorn. The salty caramel, salt, or sweet and salty something, food, popcorn, especially kettle corn, those? Yeah. Those things are good, by the way. Salty and sweet are good combinations, by the way. Because, if you eat something salty, it's just like salty and sweet, my goodness, I mean, sweet gets tiring or, but then when you have sweet and salty, it's very yummy. Hindi siya nakakaumay, parang ganun. Okay, it's not a health thing. I mean, they use coffee to cleanse the smell of perfume. Oh, really? I didn't know that. I did not know that. Okay, next question. Oh, is this the last one? Oh, it is. Yeah, okay. Alright, I will go to the new ones here. There's like new ones over here. Hold on. It's 10:16, so we're pretty much okay. There's some here that... Okay, here we go. There's one here. What % of your medical education would you say you typically use? Oh my god. That's... let's see. What % of my medical education? Okay, if in med school... If in med school, you know, you have different subjects, right? You take 4 years of medical school. At least here in the Philippines. 4 years of medical school where you have, like, anatomy. Let's see. During your first year in medical school, you'll be taking, like, anatomy, biochemistry, physiology, what else? Legal medicine or something like that. Patient-doctor relation, they'll teach you all that. So, let's see. In first year, anatomy is definitely a need, especially in surgery. You need to know anatomy. Physiology, yeah. But I think that's more, medicine, internal medicine, I guess. But no, we also need to know physiology of some things. Patient-doctor relationship, yeah, we definitely need that. Because we face patients all the time. Legal medicine, just a bit. Second year pathology, definitely need to know pathology. You know what? Oh, you know what I don't really use much? Biochemistry. Freaking I hate biochemistry was the hardest subject I ever had in med school, and I don't remember anything. Well, I probably like remember some bits and pieces of like the Krebs cycle. Oh my god. Just bits and pieces. If you're gonna ask me right now, okay, describe the Krebs cycle, or describe the gluconeogenesis, or describe, you know, glycolysis, lipolysis, and all that shit, I won't be able to describe it to you. Okay. So maybe, how do I say, 40? It's really hard to answer this question. You know what? I'm gonna show this so you guys can see. Hold on. The question. I will show you the question, guys. Okay. What % of your medical education would you say you typically use? So it's really hard to answer this, to be honest, because I can't say small percentage, because it's more like in a certain subject you take in medical school. In a certain subject you take in medical school, you only need a smaller percentage of that. Like, for example, I had biochemistry, and I only like used like 5% of that, my knowledge in biochemistry. But when it's anatomy, I use like a chunk of that, because, you know, in surgery, anatomy is very important. Maybe let's see. Maybe like 40% you would typically use. 40%. This made me remember something. Back in med school, one of our teachers said, like, you're gonna learn all these things, but when you're in your practice, you're only gonna remember 10% of what you learned in med school. And I think he's kind of right. But in my opinion, it's like around 40% of whatever you learn in med school, you're gonna be using in practice. But here's the thing, okay? Here's the thing. Medicine is an evolving practice. So even if you learn something in med school, if you're gonna specialize, you have to keep reading and keep studying. even if you're already a full-fledged doctor, when you're seeing patients, you're one way or another, you're going to end up, one way or another, you're going to still be reading something. For example, you get this patient, like let's say you're in a clinic, you get a patient who has pneumonia, okay? Pneumonia. That's and apparently not just that, has other illnesses. You are definitely going to start reading a little bit about it. You know, it's the same. So it's a continuous learning process. There's always something new. There's always new guidelines every year that you have to follow because that's the standard. You have to know all. You always have to. You have to know the guidelines because that's the standard. So around the world. So you know. Yeah. So I guess that answers. But for this question, I'd say 40%. How to make utot less stinky? I am going to ignore this question. I am going to ignore this question. What the hell kind of question is this? Get a freaking air freshener. Kumuha ka ng air freshener at sprayan mo yung butt mo. Ano lang yun. Alright. Next. My cat bit my hand early this February. I am still alive. I certainly hope so. I am still alive, so he doesn't have rabies, probably. But now there are these tiny itchy bumps on the spot of the bite. Any advice? My advice is go to the doctor in the emergency room and get shots. Okay? If your cat, if you don't have an anti-tetanus booster yet in the past 5 or 10 years, I think it's 5 years, get a booster. And yes, you can get rabies. So from, so you have to get the shots. Get the shots, okay? And clean your wound, okay? Clean your wound properly. Clean your wound properly, okay? That is my advice to you. Alright, I think this one we answered. Yeah, this is. I guess we answered everything. I think we got everything. Alright. Hey, that's actually good. We did well. Because I usually keep my medical education series for like an hour long. The latest one. Oh, really? You have another one? Which one? There's another one? Oh, okay. I think is it the one with the wrists? Oh wait, this one I did not answer this one. Yeah, you're right. Okay, let's go back. This one I didn't answer. Hello, I work out a lot. Recently my wrists have been hurting due to lifting heavier and heavier. Any tips on how to ease the pain, or do I have to get my wrists stronger? I've only bought wrist wraps for easier support on the wrist. Oh, you gotta rest your wrists, yo. You gotta rest. You have to rest the wrists, okay? Don't overwork them. It depends on what kind of workout you've been doing. If you have been lifting and bending your wrists a certain way all the time, you might get a tendon inflammation, because that's what happened to me. I had that happen to me, okay? Yeah. I had that happen to me just because I was doing a lot of surgeries. Like, almost every day, and like every few hours. Like, I got a full load of patients, and I got decurvance tenosynovitis, and I needed surgery for my wrist, my right hand, my right wrist. So, but to ease the pain, yeah, you know what? You can put like cold compress on your wrist. Rest your wrist also. Please rest your wrists. And yeah, it depends on the exercise you're doing. If it's always repetitive movement on your wrist on a certain way, you have to stop for a while. Okay? Because it will, your tendons might be, irritated and inflamed. Because that's what happened to me. That is what happened to me. Kept using my right wrist a certain way, and then I just got decurvance tenosynovitis. And which is weird because according to my orthopedic surgeon, he said that condition is usually in women who have babies, and I don't have babies, yo. I ain't even pregnant and I got it. I'm like, how the hell did I get this? But then my doctor, my orthopedic surgeon's like, have you been doing surgery a lot? And I said, yes, I have. So yeah, it's like overworking your wrist. There we go. Kakaselbo. Kakaselphone mo yan. Yeah, I think my mom said that to me. Kaka-computer mo yan. I'm like, oh my god. Kaka-computer mo yan. Bruh. I'll not call you mommy. Excuse me, woman. Nag-ara-ara lang ako, mami kayo. Alright. Yes, please take care of your wrists. Don't overwork them. If they are starting to hurt, you gotta rest them. You gotta give them some rest until they get better. Okay? Okay. I guess that's it. Yeah, that's all of it. Alright, we answered everything, I guess. And that is good enough for an hour. What is, I think, an hour and a half stream. I hope I answered your questions satisfactorily. I hope they were satisfactory. Anyway, thank you everyone for coming to my stream. I will be streaming again on Twitch. Ano ba ulit yung schedule ko? Nakalimutan ko. I always forget my own schedule. Anyway, I think Tekken is my next stream. Ay, hindi, Omori pala. Ay, oh, I forgot to pin my schedule. Wait, I'm gonna pin this. There we go. Pin. Alright, my schedule is... Tekken 8 is my next stream on Wednesday. I'm gonna play more Tekken 8. So, I am going to, on Tekken 8, I am going to probably play, ranked. We're gonna do some, of the ranked, and then probably do some of the character episodes also. Play some other characters just to unlock the endings. Yeah. Signs of aging. Bruh, I'm always busy, okay? It's not just signs of aging, it's signs of being busy, okay? Doc Shiori, can you touch your elbows together? What do you mean? Like, touch my elbows, like the tips of my elbows together? Is that what you mean? Because, let me try. Yeah, actually, I can. I can! Can be both. Tang ina nyo. Okay, let's raid. Wait, no, I can't raid. I'm not on Twitch. I can't raid. I don't know how to do I don't know how the raid feature on Twitch works. On YouTube works. So we're just gonna end stream. Manual raid. Meron bang bahala kayo kung sino gusto nyo i-raid. What's upon everybody? Thank you for coming to my stream. I hope you guys learned a lot. I'll see you guys on Wednesday. I'll be playing Tekken 8. And then after that, the rest of my streams will be Omori. And yeah. I'm gonna try inviting other VTubers for collabs. I haven't done collabs for a while. Okay, Atsupan! Bye bye everybody! Good night! Bye bye!